Hello friends, let us now learn some important points about the barium swallow. So what is barium swallow? Barium swallow is here we use a contrast agent, and by using a contrast agent we will study the digestive tract from oral cavity up to the fundus of the stomach. So from oral cavity we will study the GIT from oral cavity up to the fundus of the stomach. Then, what are the indications of barium swallow? So, main indications are if the patient presents with any dysphagia, that is difficulty in swallowing, or if there is any obstruction. If the patient has any pain in swallowing, while swallowing, if the patient pain during swallowing, while swallowing, if the patient experiences any pain, then we can do this barium swallow to know what is the cause of the pain. It is also done to assess the mediastinal mass. If there is any mediastinal mass, to find out the origin of the mediastinal mass, we will do the barium swallow. Then to assess the left atrial enlargement. So to assess the left atrial enlargement, we can do a barium swallow because left atrium is in close proximity with the esophagus. Then, if there is any, if the patient presents with any carcinoma of bronchus and esophagus, if the patient presents with carcinoma of bronchus and esophagus, then and the patient has pre-operative assessment for pre-operative assessment of carcinoma bronchus and esophagus, we can do this barium swallow. And main importantly, motility disorders of esophagus. There are some motility disorders of esophagus where the barium swallow is obvious must and do to know the peristalsis and what is the main to find out or to diagnose the motility disorder. So we can use this barium swallow for achalasia cardia. It is also used for diffuse esophageal spasm and also in motility disorder like scleroderma also. Then, if there is any perforation of esophagus, if at any stage, whenever the patient has any perforation of esophagus, in order to find the site of perforation, to assess the site of perforation, we can do this barium swallow. Then, in case of Zenker's diverticulum, or in case of, see, if there is Zenker's diverticulum, obviously the diverticulum fills with the contrast, and as a result, you can clearly delineate or see the diverticulum. And also, in case of any cricoid webs, we can do this barium swallow. So, especially in case of Zenker's diverticulum and cricoid webs, instead of using barium swallow, we use water soluble media are used. Water soluble media like either gastrografin or we have dinosil tablets, either gastrografin or dinosil aqueous can be used to diagnose this Zenker's diverticulum or cricoid webs. Next, what are the relative contraindications of barium swallow? Barium swallow is contraindicated if the patient suffers from tracheoesophageal fistula or if the patient has any perforation. Because if the patient has perforation and if barium has entered the mediastinum because of this perforation, then this barium will result in inflammation over that area and it is dangerous. So as a result, we do not use the barium swallows in either tracheoesophageal fistula or in perforation. So these are the important points about the indications and contraindications of barium swallow. Thank you.